Good evening and welcome to the second of three GIC public information sessions. My name is Matt Vino. I'm Executive Director of the Group Insurance Commission. Thank you for joining us. We're looking forward to sharing some important information with you about this year's annual enrollment and the outcome of the procurement of health insurance carriers, as well as some useful information and additional resources that can be helpful to you. For this session, we have CART services available. A link will be posted in the chat function for members to access. We are also recording this information session, which will be available on the GIC's YouTube channel. I also, before we start, just want to recognize 4 GIC commissioners who are joining in this evening to listen to the presentation. Jane Edmonds, Bobby Kaplan, our Vice Chair, Joe Gentile, and Tim Sullivan. Thank you all for making the time to join us. So I'll start with a quick review of our agenda. On the next slide, we'll provide a brief overview of the GIC. Many of you are already well familiar with us, so we won't spend a lot of time there. Then we'll walk through the changes coming to the GIC's health insurance and pharmacy benefits as a result of the procurement that our commission voted to approve last fall and early winter. Next, we'll focus our discussion on changes to our health insurance plan design for the coming year for members enrolled in both our active and Medicare plans. And finally, I'll share some information about an additional set of sessions that we are hosting in the spring in the weeks leading up to annual enrollment. And then we will move forward to respond to any questions that you may have. We'll spend most of the time doing that. So with regard to questions, you may submit those at any time during this presentation through the Zoom Q&A function, typically at the bottom of your screen. We have members of the GIC staff on hand to answer some of those questions directly in writing as we receive them. We'll provide responses also right in the Q&A function. Some of the questions that you may have, if we think they're of a general interest to all participating here, we will address them verbally for the benefit of all attendees. I do want to note that if you have a question that is personal and specific in nature, please utilize the contact form that we have listed in this slide, and a member of the GIC staff will follow up with you after this session. We will not be responding here today to questions about personal health coverage, so as to protect and maintain your privacy. So before jumping into the GIC overview, I do want to note at the outset the dates for this year's annual enrollment. As you can see, annual enrollment will start on April the 5th and close on May the 3rd. So I encourage everyone to go paperless at the GIC by registering for the new member benefits portal, which you can find at mass.gov/GIC. All state and municipal active employees and retirees with a valid email address have access to this portal. And through that, you will be able to update your personal information and view your benefits 24 hours a day, 7 days a week throughout the year. And then also when we get to annual enrollment, you'll be able to compare your benefit options and actually enroll in coverage. Use of the portal is completely voluntary. You may, if you like, continue to submit paper forms to us, and always feel free to contact the GIC staff directly. But this new tool is a really quick, easy to use and convenient alternative for you to interact with the GIC. So I encourage you all to check that out and register. You'll also be able to learn about and register for future information sessions ahead of the annual enrollment, all through the portal. So I'll now move on to the GIC overview, and we will start with GIC's mission. which is to provide you, our members, with high quality and affordable benefits while driving improved health for our members and higher value care delivery across the Commonwealth. So this continues to be our touchstone at the GIC. On the next slide here, just want to note that we really meet this mission through our coverage offerings, which include a wide range of options, including health insurance, dental, vision, life insurance, and long-term disability benefits. These are all, I'm sure, very familiar to all of you. Next, we want to highlight some key data points about the GIC, including the fact that we now have over 460,000 members, which makes us the largest purchaser of healthcare in Massachusetts. We are also governed by a 17-member commission. I mentioned 4 of them have joined us here this evening, and we partner with 918 agencies, including municipalities, regional school districts, and a wide variety of other state and local agencies. So our reach and the complexity of our operation is quite broad. So the next is kind of a visual explanation of how the GIC is funded. As you can see, the Commonwealth of Massachusetts, through an annual appropriation, funds the lion's share of your benefits. Cities and towns that also purchase insurance for their employees through the GIC also fund a portion of that premium. And of course, as you know, members, you yourselves fund the remaining portion of the premium seen here in purple. I want to note that the GIC's health benefits on the next slide are financed slightly differently than you may have seen elsewhere. That's because the GIC through the Commonwealth is self-insured. So what this means is that the Commonwealth pays the employer share of medical premiums, and regardless of how much is budgeted for our total claims, the state really holds the insurance risk, not the health insurance companies. So if medical claims exceed what the Commonwealth has budgeted, it's the state that will pay those additional claims, and those do not impact our membership. So at the bottom here, just as an example of kind of the logistics, as a member, when you receive healthcare service from a doctor or a hospital, they'll send a bill to the insurance company that in turn pays the doctor or hospital. Our insurance companies then bill the GIC, and we in turn reimburse the insurance company back. So it's a little different than the way it operates in the private insurance market. So before we move on to health insurance premium rates, just a quick reminder again that you can submit questions at any time during the presentation and the Zoom Q&A function, and we will pull some of those out to address verbally in the question and answer session. And please don't type in questions that are personal and specific in nature so that we can handle those offline and maintain your privacy. So now we want to move on and say a few words about our premium rate development process for the coming year. This portion of the presentation will be fairly brief as we are still working on this, and it won't be completed in early March. As you can see here, our timeline for finalizing our premiums runs from December through March. And we had an initial discussion about preliminary rates with our commission back in December. That was based at the time on the information we had at that time. And we're really looking into the future to July 1st and really through the end of the coming fiscal year, June 20th of 2024. So there's a lot of uncertainty about those projections. And we use the subsequent few months after December to really nail those projections down. We presented our proposed plan design changes to the commission in January, last week, and we'll be reviewing those with you today. Both of those meetings are available on the GIC's YouTube page if you're interested in watching them. So at our next meeting on February 16th, the Commission will be voting on the proposed plan design changes, followed by a Commission vote on premiums for each specific plan on March the 2nd. So on the next slide, here's where we'll talk a little bit about our projections. So these are preliminary rates, as I've said. We developed them based on an assumption that there'll be no changes in our plans, the insurance products we sell, the companies we work with, funding, or member enrollment in each plan. So some caveats there. So the expected aggregate increase here, I want to note, really important, this is an average across all of our plans, both Medicare and non-Medicare. However, it's important to note that specific products that we sell, insurance products, will each have their own specific increase, which may fall outside of the range that you see noted below. Those are the numbers that we will determine for each specific plan in early March. So below the blue arrow here, you'll see a gray box. At this point, we are projecting an aggregate premium increase across all of our plans of 6.7%, but that is within a possible range of between 4% and 8%. While still more than we'd like to see, an increase of that sort is smaller than what most people outside of the GIC are facing, which, if you look at the yellow boxes here above the arrows, is between 5% and 9%. So we will continue to do everything that we can to moderate these increases on your behalf. So next, we'll move into the results of our health benefits procurement, which, if you've been following the work of the Commission, you will have some familiarity with. By way of background, we are currently in year 5 of really the 5th and final year of the contracts with our current plans. And we are required by state law to go through this process at least every 5 years, to choose the companies that we will work with for the coming 3 to 5 year period. As you can see on the timeline here, we spent most of 2021 developing our strategy, gathering information, reviewing our data, and talking with outside experts, as well as you, our members. So this has included our member preferences survey that many of you participated in last summer. If you did so, thank you for doing that. Really important feedback for us. In April of last year, 2022, we issued our request for responses to insurance carriers. And then we spent the subsequent months reviewing those submissions from the insurance companies and the pharmacy benefit managers, and then presented our recommendations to our Commission, which they then approved the health plan selection in October and the pharmacy benefit managers in December. So we are now finalizing our changes so that we can be ready to offer you coverage in the annual enrollment in April and into the first few days of May. And this is all for coverage that will begin on July 1st of this year. But before we do that, we hold these sessions every year as our way of informing you and getting your input before we proceed. So a very brief reminder, you've again probably seen this before if you follow the work of the GIC. Our 3 main areas of strategic focus are to provide quality benefits that are as affordable to you as possible, to close the gaps in health equity that are driven by structural and longstanding challenges, and to do our best to improve access to behavioral health services. So these continue to be real important guides to all of our key decisions. On the next slide, so we're going to walk through the results of the procurement, and we will have new companies to manage the pharmacy benefit for our active members and for our flexible spending account. As you can see here, prescription drug benefits for active and non-Medicare retirees, which is currently offered through Express Scripts, will transition to CVS Caremark. For those of you who are enrolled in Medicare plans, however, your prescriptions will continue to be administered by CVS Caremark through the Silver Scripts program as they have for the last 5 years. Here, I want to make an important note that a pharmacy benefit manager, which is what we're talking about here, also known as a PBM, is different than a pharmacy, right? A retail pharmacy. So while the CVS brand applies to both the pharmacy and the PBM, with this change, members who do not have access to a CVS pharmacy or simply prefer to use a pharmacy that's not CVS will still be able to do so with this change of our pharmacy benefit manager. You will still have broad access to retail pharmacies beyond just CVS. Also, starting on July 1st, our flexible spending accounts, commonly known as FSA and Health FSA, will transition from Benefit Strategies to a company known as Task. This will occur for both the Health FSA and for the Dependent Care FSA. We will make every effort to make this changeover seamless for you, our members, and part of that will be working with this new company, Task, to have a claims run out and grace period during this transition. So two changes there. Now I want to move on to plan design changes. So we're moving on from procurement, now talking about our plan design changes, and we'll start with our active medical plans. So this slide should look familiar to you. These are the current plan offerings for active and non-Medicare retiree members. As a result of the merger or rebranding that is happening with some of our companies, there will be some changes, but all of the incumbent carriers, all the carriers that we've worked with that would like to continue to work with us, we are going to continue to work with them. They all submitted bids and were all selected by the GIC to continue. Here is a summary of the changes, if approved by the Commission, that will become effective on July 1st. For residents outside of the 5 New England states, we will be offering a new PPO plan from Harvard Pilgrim Healthcare. This will replace Unicare Basic as the option for members who reside outside of those states. There will also be a significant change, and I think a positive change, to the premium structure for those current Unicare plans that today include CIC, which I think you will like, and I'll go into more detail on that in subsequent slides. Additionally, there will be some changes, some minor changes to Unicare copays to standardize them with what is offered in other health plans in New England. Also want to note, Always Health Partners has recently changed their name to Mass General Brigham Health Plan. We will be making that change, so we also are making an additional change here, pardon me, making this plan available to anyone residing anywhere in Massachusetts, not just in Eastern Massachusetts. So we'll touch on that again in a moment. As many of you know, Tufts Health Plan and Harvard Pilgrim Healthcare merged last year under the same parent company named Point32 Health. And as part of that merger, they chose to offer only Harvard Pilgrim plans for our active employees. So an important change coming as a result of that decision. So Tufts Navigator and Tufts Spirit will no longer be offered starting on July 1st. And I want to emphasize here that the discontinuation of these two plans, this is based on a decision made by Point32 as a private company. This is not a decision or change that was made by the GIC. So because of the changes to so many of these plans, on the next slide, we'll be renaming most of the plans, trying to help mitigate potential confusion. So, as I previously mentioned, the national plan for those residing outside of New England will be through Harvard Pilgrim Healthcare, and that will be called Access America. I also want to note here in the upper right, Health New England, with its regional network, for those residing in Western Massachusetts, there will be no changes to name or any other changes to Health New England. The broad network plans in the middle box here will be available to those residing in New England and will be, as noted here, Unicare Total Choice. So this is the successor plan to Unicare Basic, which will continue to be our indemnity plan and will also be available to international residents. Unicare Plus will continue under that name as an additional indemnity plan with a different plan design than Total Choice, but same plan design as it's been in the past. Harvard Pilgrim Healthcare, we're introducing the Harvard Pilgrim Healthcare Explorer POS plan. This will also be available throughout New England and will require, as all of our POS plans do, for a member to designate a primary care physician. Mass General Brigham Health Plan Complete HMO, so this is the successor to the Always plan. This is the one plan in this broad network category that is available to Massachusetts residents only as a state-based HMO plan. And then finally, our limited network plans, narrow network plans, both of which are available everywhere in the state except Nantucket and Martha's Vineyard. They will be Harvard Pilgrim Healthcare Quality HMO and Unicare Community Choice. So the Harvard Pilgrim Quality HMO is really the successor plan to both Harvard Pilgrim Primary Choice and the Tough Spirit narrow network. So I know there's a lot of name changes here. So a little later in the presentation, there'll be a slide that will go a little further into detail about which plans that we offer today are comparable. What are the comparable plans that we're putting forward for next year based on what you may have been in or are in today. So with that as a little bit of an overview, I'll kind of spend a little more time in detail on some of the plan design changes. We'll start with Unicare. First, as you all know, two of the Unicare plans, this is Unicare Basic, which will, as I said, now be known as Total Choice, and Unicare Medicare Extension have a premium component known as the CIC. This is a statutory legacy program that has been a member pay-all portion, so you pay the entire premium for this add-on, and it's really been made redundant by plan design changes to the marketplace and the regulatory environment over the last several years. For those who have been enrolled in the plan with CIC, you'll want to pay close attention here. But if you're enrolled in a plan, in the Unicare plan without CIC, you know that this leaves you at significant financial risk, since that plan has coinsurance that applies to several services. So here we are recommending to wrap in the CIC premium component going forward for all members in Unicare Total Choice and Medicare Extension. So this means that the Commonwealth will essentially absorb their portion of this additional premium based on your date of hire. So for instance, if you have less than 20 years of service and your premium contribution from the state is 75%, the state will now pick up 75% of the cost of the CIC add-on. And if you're more than 20 years of service, 80% premium contribution, that will now apply to the CIC. So it will no longer be member pay all for that added coverage. This change will harmonize the CIC coverage across both of these unit care plans, and both will now include basically the CIC coverage. So on the next slide, we walk through the other changes to the unit care plans, which are really aimed at standardizing co-payments across the plans the GIC offers. So the first change you'll notice here will apply to outpatient co-pays for unit care plans. The copay will be $150 for eye and gastrointestinal services received at ambulatory surgical centers, and there will be a $250 copay for all other outpatient services. This will make these copays essentially the same as other broad and limited network plans that the GIC offers. Additionally, Unicare Total Choice will have a $45 copay for all specialist office visits. And lastly, Unicare Plus and Community Choice will have the same copays for PCP visits as all other GIC plans that we offer. So you'll see we're trying to drive at more consistency with some small changes to plan design here. Next up is the changes to Always, now to be known as Mass General Brigham Health Plan. As I said, as I have said in the past, this is a plan that we've had for a number of years. A few years ago, it was actually named Neighborhood Health Plan before they changed it again, and now again. These name changes are, again here, the decision not made by the GIC, but by the private company that will go by the name MGB Health Plan. So in addition to the name change, over the last few years, the plan itself has changed a lot. So there used to be a regional plan offered mostly in Eastern Massachusetts, but they've expanded significantly in the insurance market where they now reach all of Massachusetts. It also used to be a plan with a lower premium compared to other plans that were offered by the GIC. So our plan designs really need to account for these evolutions and changes in this insurance company. So the first, as I said earlier, will be that the plan will now be available to GIC residents, no matter where GIC members, no matter where you reside in the state. But we also need to make sure that we have aligned incentives across the GIC population. So we are applying higher cost sharing to providers and facilities that are high cost to align with the approach that we've taken across our other plans. So this will mean that some members will see higher co-payments if you want to continue to get your inpatient care at the most expensive hospitals. Again, this is an approach that we take across all of our other broad network plans. So you can see the new copay structure, the changes here that we've made to Always. So the next slide really summarizes the changes that we've discussed that result from both the procurement and the plan design. Across the top, you'll see the insurance companies that we've selected, and down below, you'll see the changes to plan names and co-payments. The changes are highlighted in yellow, so you can see where we've made the changes that I've already walked through. So here, I want to linger on this slide for a moment. It's a rather busy slide. I would encourage those participating to take some time to review it after the presentation. What we're trying to do here is to, as we transition from our current offerings to new offerings, we want to ensure that everyone has coverage, right? We want to make sure that no one loses coverage. We highly encourage all of our members, especially with the changes this year, to spend some time evaluating all your options and to shop for the plan that best meets your needs. But if you do not select a plan yourself by actively enrolling, we will automatically place you in the most similar plan design in our new portfolio. That said, again, we strongly recommend that you review your benefit guides when they come out before annual enrollment. Check to see that the doctors and hospitals that you rely on are included in the network, so that you can make sure that whatever plan you select is the right one for you. So now I'll move on to a brief discussion about changes to our Medicare plan offerings. First one I discussed a little earlier that relates to Unicare and the separate CIC coverage, which we are essentially folding into the premium, and the Commonwealth will absorb its share of the cost of the CIC. Second, as a result of the merger of Point 32, this is Harvard Pilgrim and Tufts coming together. I mentioned this earlier. The Tufts Medicare complement, which is the Tufts Medicare supplement plan, will no longer be offered to our Medicare eligible retirees. So we encourage you, as I said before, to evaluate all your options during the annual enrollment. And again, here, members who do not actively select a new plan will be automatically transferred into the Harvard Pilgrim Medicare Enhanced plan. This Harvard Pilgrim plan, very similar to the Tufts complement plan. So we don't anticipate really much of a change at all for those who are making this move. So lastly, I just want to note there will be no changes to the Tufts Health Plan Medicare Preferred Plan. This is our Medicare Advantage option, and also no changes to the Health New England Medicare Supplement Plan. I know we've covered a lot today so far, and you likely still have a lot of questions. Just a reminder, I see lots of questions already coming through on the Q&A function, but if you have them, please jot them down and we will be responding throughout the meeting. And again, if you have a question that's specific in nature, personal health related questions, please use the member contact form noted here. So I'd like to invite everyone to another opportunity to engage virtually with the GIC ahead of annual enrollment this year. We're pleased to offer a new feature. These are annual enrollment sessions, which we'll be offering in middle of March and late March, focused on annual enrollment. There'll be 2 sessions dedicated to retirees, the 14th and the 16th, and 3 sessions for active non-retiree members. These sessions will be conducted similar to today's sessions, with an overview of your options ahead of annual enrollment and an opportunity to ask questions and interact with us. As you've taken from my presentation so far, we still have some additional decisions to make. Need to finalize plan design, finalize rates, and we want to have the opportunity to come back before you for one last opportunity before annual enrollment launches. So that's what these are about. And again, you can enroll in these. You'll be able to enroll in these through our member portal and on the GIC website. So on the next slide, just a reminder that our annual enrollment will be April the 5th through May the 3rd. And as we transition to the Q&A portion of this information session, we'll put up a slide here with additional resources that are available to you. And with that, thank you for your patience. We are happy now to turn to the question and answer period. And as we wrap up, I just want to thank each of you for your attendance and your continued engagement. As I noted earlier, These sessions will be recorded and available on the GIC's YouTube page, and the materials from this presentation, this slide deck that we're using, will also be available on our website. It's mass.gov/CIC. So thank you again, and best wishes for a healthy and happy new year. With that, I'll turn it over to our Chief of Staff, Emily Williams, who will facilitate the question and answer period.
Thank you, Matt. Yes, we've been receiving a lot of great questions using the Q&A function, and I encourage you throughout the rest of the presentation, if you have more questions, please feel free to use the function to ask them. And we do have staff standing by who are responding immediately. So the first question, Matt, is we're receiving a lot of questions about my plan is changing or my plan is going away. What is the best way to verify that my provider will still be covered under a new option?
Sorry, I had myself on mute. The best way to do that is to visit each insurance company's website. They are required by state law and by contract to us to have detailed provider directories. You can look up any kind of physician that you want to make sure is in network, hospitals that are important to you to be in network. We will have, as we have the last several years, kind of a clearinghouse page on our website where you can find out more summary information about each carrier and each plan, but also links through to each carrier's provider directory. So that's really the best way to know. Come up with a list of the doctors you currently use, look them up on each carrier's website, and that will give you the information that you need.
Thank you. And we have a question asking how we selected Task as the new administrator for FSA benefits.
Yeah, so for this question, I will hand it over to Jim Rust, who's our Chief Financial Officer, also our Chief Procurement Officer, and members of his team who managed that procurement. Jim?
Thanks, Matt. So as Matt mentioned during the presentation, every 5 years we re-procure. So we do a procurement for all the services and benefits we offer, including the FSA. So we did that through an RFP process, and we score the vendors who have bid on a variety of components, including cost, best value, ability to deliver the services, and all those kind of things. So we did that. We ran a process. Process was scored, and Task was the winner. So that is how they were selected.
And that was it's essentially a staff recommendation to the commission, which, as with all procurements, makes the final decision. Thank you, Jim.
Thank you. And remaining on FSA, we're receiving a lot of questions to clarify if this change will also impact transportation benefits, which are also administered by Benefit Strategies.
I think Cameron McBean from our Health and Ancillary Benefits is available for that question.
Yes, the commuter and parking benefits are administered directly by the Comptroller's Office. The GIC does not have any responsibility or influence over those benefit programs. And to the best of our knowledge, they are remaining with Benefit Strategies for fiscal year 24. We've not been told of any change.
Thank you, Cameron. And we have a question. Will I need to get my prescriptions from a CVS pharmacy since you are moving to CVS Caremark?
Yeah, the answer to that is no. As I mentioned in the presentation, we're changing our pharmacy benefit manager, which is our administrator of the plan. But the retail pharmacies that you go to fill your prescription, you may go to CVS. If you prefer to use or don't have access to a CVS, you can use other pharmacies. Walgreens, Target, Walmart. There are a variety of other options, independent pharmacists. Those will be included as access points for you to fill your prescription. So we're making the change to the PBM, but not to the retail pharmacy access for you.
Thank you. And a follow-up is, can I still get mail order prescriptions with this new PBM?
Yes, you can. CVS Caremark has that capability. This is one of the capabilities of CVS that we evaluated closely. We strongly believe that mail order, particularly for maintenance medications, is a very convenient and less expensive option. We have some incentives, in fact, for mail order that will continue. So that's not going away. It will be administered much the same way as it has under Express Scripts.
Thank you. And one more pharmacy related question. What do I have to do to transfer from Express Scripts to CVS?
So I will hand this over to Jim and or Janine Dewar, who handles the pharmacy benefit manager. But essentially, we will be handling this transition for you, and you'll be getting some additional information about the transition. Jim or Janine?
I'll take it. So we have data with Express Scripts that will be transferred over. Obviously, it will be very secure. So the data that we have with Express Scripts for our members will be transferred to CVS, and that way we can ensure that there's a seamless transition between the two. So PAs, prior authorizations, anything that you have on file with ESI will transition over. That will include any mail orders or anything that you have from a retail pharmacy. And if there are any troubles, you can contact the GIC and CVS, and you should be receiving letters. Just keep a lookout. We'll also have welcome packets, so you should have as much information as you need to be able to transition seamlessly.
Thank you, Janine.
Thank you. And will there be any changes to dental and vision plans?
So no changes to dental and vision plans. Those were not up for a procurement process this time around. We made that decision, I want to say it's 1 or 2 years ago. So no changes this year to dental or vision.
Thanks, Matt. And we received a question, why doesn't GIC offer an individual +1 plan in addition to the family plan and individual plans?
Yeah, it's a very good question. We do regularly evaluate the possibility of offering an individual +1 option. What we really try to take into account while we're evaluating that is how broadly this will impact the entire membership, and try not to have sharp changes in premium for those in the plans plan types that we will continue on with in terms of an individual plan and a family plan. So whenever you make a change like this, it can lead to some pretty dramatic shifts in premium. And one of the values of insurance is sort of the stability that we're able to bring to our members. So we will continue to evaluate this. We do get this question quite a bit, and it is on our radar. Thank you for the question.
We received a question about telehealth, asking if the healthcare plans will still cover telehealth.
They certainly will. I and we and the commission all feel strongly that telehealth provides greater convenience to our members. If you can interact with your clinician in a way that doesn't require you to go into the office, then we should provide that. And so this was another capability of the plans that we evaluated closely. So our commitment to telehealth remains strong, and it will continue to be an option for our members.
Thank you. And we have a lot of questions asking if we could clarify again what CIC coverage is and explain what CIC is.
For that one, I'd hand it over to Cameron and perhaps Andrew to talk a little bit about what CIC is.
Sure. And Andrew, feel free to step in if you'd prefer to handle this. But basically, CIC is a bit of obsolete plan design that was part of our governing statutes. So we were mandated to offer it. However, in the decades since it was implemented, what had been carved out as CIC or catastrophic illness coverage, you know, in the event of something like requiring a organ transplant or a cancer treatment, that is included on all of our plans. So requiring members to pay extra on those two Unicare plans for that coverage, which is included in all of our plans, didn't make sense, and this was an opportunity for us to rectify that.
Thanks, Cameron.
Thanks. And I think we can move back to the rate slides to answer these questions, but we've received some questions about if you can repeat when the plan design and rates will be voted on by the commission.
Yeah, the plan design vote by our commission will be, I believe it's February the 16th, and the final vote on rates on March the 2nd. And again, all of this information you can find on the GIC website.
Thank you. And we've received some questions about when members will have the opportunity to engage with GIC again ahead of annual enrollment after those votes have been taken, and what type of information they can expect to receive ahead of annual enrollment.
So you will, a few things here. So we'll use all of our tools to communicate to you that we have traditionally used. You will receive benefit decision guides in the days leading up to annual enrollment. You can use our member portal, which I mentioned, which will allow you to do side-by-side comparisons of the different plans that we're offering. And as I'd mentioned earlier, and you see on the slide here, we are holding this separate set of member annual enrollment sessions. So by that time, we will have finalized plan design changes after having them voted by the commission. We will have carrier-specific, plan-specific rates, as opposed to today, what we're offering you, what we have at the moment are the aggregate increases across all of our plans. So, and we will have some other additional information to offer to you. Our intent is not to have these sessions be super duplicative of the session that we're holding today. We will have some overlap, but our intent really is to give you everything you need to prepare for annual enrollment through all of these tools.
Thank you, Matt. And we've received the question, I'm a retiree and my covered dependents health plan is no longer available. And I don't know if I want the default plan option. What should I do?
Well, I would, I may ask Paul if there's a nuance here that I'm missing, but I think what you want to do is, you know, through all the tools that I just went through, either the benefit decision guide or the member portal, or come to the information sessions, learn about the different offerings that are available to this dependent. There are a few changes this year, so it really is worth your while to spend a little bit of time looking at the different plan options, and also give us a call, right? Reach out to the GIC. We're happy to assist you in evaluating plans. We can't make recommendations on different plans, but we can help you understand based on your needs what you should be looking at.
Thank you. And this may be a good one for Paul. I am a retiree with my residence in Massachusetts, but I travel for a large portion of the year to another state. What are my options?
Sure, I can take that, Emily. GIC does offer, as Matt said, many different plans for all of the members. With some of the changes happening this year, as Matt stated, if you reside outside of New England, your choice will be the Harvard Pilgrim of the Access America plan for residents outside of the 5 New England states. If you reside within the 5 New England states, there are still many plans available to members. And those plans do cover dependents outside of the service area, whether they're a dependent living in another state or a full-time student. So we would recommend that you can contact the plan regarding options available for any dependents that live outside or full-time students outside of the service area. So the plans do offer some coverages, but some plans do not. But all plans cover emergency services. So it's always good to check with the plan before receiving any services.
Thank you, Paul.
Thank you, Paul. And I have another retiree related question. If I retire now and continue to use my spouse's insurance plan, can I enroll in GIC insurance plans for retiree at the late date?
Sure, GIC has the annual enrollment every year, as you can see what we're talking about here. Retirees can enroll during any annual enrollment period in the spring for coverage effective July 1st. If you are covered outside of the GIC through a spouse and you lose that coverage outside, GIC has what we call qualifying events. You can apply for GIC coverage within 60 days of losing your coverage outside with documentation that you have lost that coverage. So you can do it within 60 days of losing the coverage and come in with GIC, or during any annual enrollment period, and no proof of loss is required.
Thank you. Thank you, Paul. And that's, to the earlier question about how the member enrollment sessions may be different. The fact that we are focusing 2 of our sessions on retirees will give us an opportunity, more of an opportunity than we have here today, to speak to kind of those types of retirement related questions. So please join us on the 14th or 16th if you can.
Another retiree related question. If you are not 65, but you are retired and non-Medicare eligible, can you select the Harvard Pilgrim All Access plan? Access America plan. Sorry, Paul.
Yeah, if your residence is outside of New England, that is the plan option for you. Did I have that right, Paul?
Yes, that's correct.
And similarly, I think this is a question from an active employee, but is it possible to get life insurance for family members who are not employees of the state?
GIC currently does not offer life insurance to dependents or spouses, just to the employee or retiree.
Thank you, Paul.
We received a question about if any materials from today's session will be available after the session's complete.
Yes, the video of the presentation, all three of the presentations that we will hold this week will be on the GIC's YouTube page. And the materials, the actual slide deck we're using here will be posted on our website today.
Thank you. And we have a question. When I enroll in a plan, how long does it take to become active after enrolling?
That's probably a good question for Paul Murphy.
If you apply for coverage during annual enrollment, coverage is effective July 1st. If you're a new hire, you have a 60-day waiting period from the date of hire. And if you are coming in with a qualifying event, you apply within 60 days of the qualifying event, and you can select the month of the qualifying event or the following 2 months after that qualifying event. So there's many different options. I would always suggest, if you have any questions, to contact us directly regarding the effective dates.
Thank you. Is there a requirement for a specific period of time to be either an employee or an active participant in a plan for my spouse and I are covered to by these plans for retirement?
For a retiree to be eligible for group insurance coverage, you have to be collecting and receiving a monthly pension check. So there is no time frame that you have to be enrolled, but to be eligible for benefits, you have to be collecting the monthly pension check from a local retirement system or a public retirement system or the state retirement system.
Thank you. And I think there's still a number of questions about what I should do if my plan is no longer going to exist, particularly around the TUPS plans for active employees and what their options will be. And perhaps we can go back to the slide that shows some of the defaults.
Yeah, so while we navigate there, again, forgive me for being a broken record, but what I would strongly encourage you all to do is to shop for your options, right? This is not a routine year of changes at the GIC. A lot of this driven by the requirement that we reprocure all of the benefits. So this is really one of those years to engage, evaluate your options, check your physicians and doctors to make sure that they're in various networks, evaluate the cost of the plan. If you're looking to make some trade-offs for a lower cost premium, we have lower cost options that may be available, that may be appropriate for you. So really, I encourage everyone to shop. If you do not shop, we will place you in the most similar plan that you are in today. So if you're in TUPS Navigator, you will be migrated to the Harvard Pilgrim Explorer point of service plan, which is, as noted earlier, very similar to the plan that you would be in today.
Thank you. And we have another question about residency. I live in Massachusetts, but as a retiree plan to travel, do all plans cover in the same manner, or is it emergency services only that are covered?
That would probably be a good question for either Paul or Cameron to take.
I can start, Matt, and then
Yeah.
Cameron, if you want to chime in. If you live in Massachusetts and you travel, as we said earlier, for emergency situations, all plans will cover you. If you want routine care outside of the plan service area, some plans do not cover routine care outside the service area, and you'd have to check directly with the health plan about services out of the area. As far as Medicare plans go for retirees, the Medicare plans aren't changing. So Medicare will cover you nationwide, all the Medicare plans, except for the Tufts Medicare Preferred Plan. That is a network plan, mostly in Massachusetts, but all of the other plans that we offer, Medicare covers you throughout the nation. If you're traveling abroad, emergency situations cover you. And if you're going to permanently reside abroad, then the Unicare Basic Plan is the one that will cover you abroad. But most services are covered in emergencies, but always check with the plan when receiving care outside of the plan service area, routine care.
All of the GIC's broad network plans, with the exception of the Mass General Brigham Complete HMO, because it is an HMO. All of our other broad network plans have expanded service areas that would allow for coverage of dependents or members to locate providers who would be considered in network throughout the country. But as Paul indicated, if you are overseas, your best bet by far is to be in one of the Unicare plans, either Total Choice, which is the new name for Basic, or the Medicare extension plan offered by Unicare, as it is the only one that will pay for non-Medicare provider services.
Thank you both for that.
We have a question, if you can again review what the options will be for those who are currently covered under Tufts Medicare Complement.
I'm sorry, can you repeat the question, Emily?
Yes, what the options will be for those who are currently covered under Tufts Medicare Complement.
So we have the Unicare Medicare extension, which is a Medicare supplement plan, and you will have access to the Harvard Pilgrim Medicare Enhance, which is also a Medicare supplement plan.
As well as Health New England's Medicare supplement,
Yes, sorry.
or the Medicare Advantage plan that will still be offered through Tufts.
Thank you for that.
Thank you. And I see a few questions about when the links will be posted from these sessions, and they will be posted within a few days when these sessions are. They will be posted on the GIC's YouTube page, where you can also find our commission meetings. We have a question: are all employees eligible for the Harvard All Access plans?
The Access America plan will only be available to active employees and non-Medicare retirees whose state of residence, as reflected in our systems, is outside of New England, meaning any place from New York, west or south.
You travel overseas, and this is for active members. If you travel overseas, are you still covered by your plans?
For emergency services, yes. And that is true under all of our plans.
Thank you. And there are still a number of questions about the best way to engage and to learn more about your options. So if we can just navigate back to the annual enrollment sessions, which will again be webinar style, such as this, and we will be able to talk more in depth at those sessions about all of these changes and options. And I see some questions about asking about rates again. So if you can clarify again, Matt, on when rates will be available.
Rates will be available on at our March 2nd commission meeting. So you'll be able to see the decks that day or soon thereafter, which includes the rates. But if you want to learn it in real time, you may log on and watch the meeting live through our YouTube live stream.
I have a general question for Medicare retirees. What plans are available for those who reside outside of New England?
I think those that reside outside of New England, all the Medicare plans except the Tufts Medicare Preferred. That's usually a Massachusetts network, but all of the Medicare plans that we offer cover nationwide.
Thank you, Paul.
Thank you. And Paul, we have another question. If I'm turning 65 soon, what should I do?
If you are turning 65 and you are retired from the Commonwealth, GIC will send you a letter 3 months before your 65th birthday for you and or your spouse if you're covering a spouse under the plan. So if you're retired, we send you a letter advising you about the Medicare plans that we offer. You have to change to a Medicare plan. We also will require you to enroll in Medicare Part A and Medicare Part B. You do not need to enroll in Medicare Part D. D is in dog for the prescription plans. GIC offers comprehensive prescription coverage on all of our Medicare plans. If you are over age 65 when you're retired, then GIC will send you a letter outlining your Medicare options as soon as we receive your retirement information from your agency. If you are approaching age 65 or turning age 65 and you remain in active service, you do not have to enroll in Medicare Part A and Part B. You can defer the Medicare enrollment if you continue working after age 65. It's only if you are retired over age 65 or retired turning age 65, GIC requires you to enroll in a Medicare plan and take your Medicare benefits with Social Security.
And we have a question about how can you use your insurance while overseas? And I think this means for a short amount of time, not an extended amount of time.
For coverage overseas, the Unicare plan, you can present your ID card for any services. If the card is not accepted, you may have to pay out of pocket. If you pay out of pocket, you need receipts and copies of all that information. When you return to the States, you can file a claim directly with Unicare for reimbursement. So it varies on where you're going outside of the United States. Sometimes the card is accepted, other times you may have to pay up front, but you can immediately file, claim, keep the receipts with the health plan when you return.
Follow-up to that is if traveling outside of the United States and an emergency service requires a follow-up prescription, is the prescription at the out of US location going to be covered?
Probably again for either Paul or Cameron.
I'm sorry, what was the question?
If a prescription is required while traveling overseas, or an emergency service, will the prescription be covered?
Generally speaking, you will be required to pay any out-of-pocket costs when traveling overseas, and you'd submit claims for reimbursement.
We received the question, is Unicare the only plan that covers non-emergency services outside of the US?
That's correct.
And do you pay the same fees for your health insurance when you retire?
When you retire, you pay 20% contribution as a retiree. So currently, all new retirees pay 20%. When enrolling in the Medicare plans, you do have a lower copay and deductibles go away under most of the Medicare plans, so there is some savings there. The Medicare plans also are offered at a lower premium, and the contribution is reduced. If you pay 25% as an active employee, you will pay 20% as a retiree. And as Matt said earlier, if you've been with state service for quite a while and you currently pay 20% as a active employee, you will pay 20% as a retiree.
Thank you, Paul.
You, Paul, and I see a question about when members will be able to register for the member enrollment sessions. We will be making those links available after the public information sessions are complete. And the best way to get that information would be to register for the portal, and we will also make them available on our website, and it will be shared on all social media channels and all other ways that these public information session registration links were shared. All right, I see our staff is hard at work still answering some of the remaining questions in the Q&A function. And again, if you have more specific or personal questions for your privacy, we do recommend that you use the contact form, which is in the chat, where you will be reaching out directly to the GIC, and a member of our staff will get back to you. All right, Matt, I see the questions are starting to wind down, coming in from the Q&A function. Again, we still have staff who are actively answering those. I do
Go ahead.
think I see one question. Is enrolling in, when you turn 65, is enrolling in Part A requirement for Medicare?
Another good Paul Murphy question.
If you are retired, enrolling in Medicare Part A and Part B is required when you turn 65. However, if you are age 65 and continue working, enrollment in Part A is optional. You do not have to enroll in Medicare Part A if you continue working after age 65. If you do, that is fine. It's hospital insurance. There's no premium for that. So it depends on the member. You can enroll in Part A if you want and continue working, or you can defer the Part A after age 65 if you're going to continue working. There's no specific rule. It's really up to you and Social Security if you want to enroll, but it's strictly an option. It's only when you are retired, you have to take the Medicare Part A and Part B.
Thank you, Paul. And I see a question. Does the GIC have navigators available for individuals who would like close guidance for help with choosing plans?
We do. We don't, as I mentioned earlier, we're not in a position to make specific plan recommendations, but we have a team of very informed, dedicated staff who are eager to assist our members. Paul, or someone else, if you can say what the phone number is, or certainly reach out to us with the contact form. We are happy to help guide through what is sometimes a complicated set of decisions. So yes, the answer to that is yes.
Yes.
And it's worth saying, I think the phone number is on the slide with questions if you want to pull that up, Emily.
Paul, another question for you. Is there a penalty if you don't enroll at 65, even if you don't use Medicare?
If you don't enroll in Medicare at age 65, it depends on your status. If you are retired, you must take your Medicare Part A and Part B benefits. Otherwise, your GIC benefits will end. If you continue working after age 65, there is no penalty for not taking your Medicare benefits if you continue working. But once you retire after age 65, you have to enroll in your Medicare benefits. So if you're going to continue working, there is no penalty. You simply defer the Medicare, because while you are working, your GIC health plan pays primary. So there'll be no penalty until you retire. You have to go in the Medicare plan.
Thank you, Paul.
All right, the questions are starting to wind down. And again, I encourage you, if you have a specific question specific to your situation to protect your privacy, please reach out to the GIC using the contact form in the chat function.
All right, should we wrap it up then? Unless you have any last questions that come in, maybe give it a moment.
Just giving it a moment here. We did get a question again about whether the GIC would be offering an individual +1 plan.
Yeah, the person who probably joined a little late, we did address that. We do continue to evaluate that periodically as a potential option. But at this time, we're not proceeding to add an individual +1.
All right, and I think the questions are slowing down. Again, if you have personal questions, please reach out directly to the GIC so that we can assist you individually. And I will hand it back to you, Matt.
Thank you, Emily. I would say that
Sorry,
about
we
really,
did
but
have,
go
sorry,
ahead.
we just had one more question come in, I think, asking we have a rationale for why one plan is available for non-Medicare retirees outside of New England.
Only one plan? That's what it sounds like. Yeah, we did evaluate options. We did have more than one bid for the out of area coverage, out of New England coverage. The choice to go solely with the Harvard Pilgrim plan, Access America, is that it was a very strong bid from Harvard Pilgrim. It's going to provide coverage that is very, very comparable to what is offered today under basic to those individuals at a significantly reduced price point. So we felt that that making that the option was the best way to go.
All right. Thank you, Matt. And again, we will be communicating out about the annual enrollment sessions and sending registration links prior to those. And we hope that everyone will attend as well. Pass it back to you, Matt.
Thanks, Emily. Thanks to my team. Thank you all who have logged in for this information session. We really do value your attendance and your engagement in these important matters, particularly this year, as it's a year filled with many decisions on our part. So thank you for that. I would note, we've mentioned a few times during this call that for personal or specific questions, members should reach out to the GIC directly, either by phone or through our contact form online. I would say that about any issue that you have with the GIC, please feel free to reach out to us about any issue, big or small, and we're happy to tell you what we know and how we can be helpful. So thank you all. Appreciate your attendance, and wish you all a happy new year.